Good afternoon, Pulse and Raisin. Let's begin the warm-up session. Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to continuously learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning. I'm Paulson, one of the nurses here in the surgical ward. May I know your name for the records, please?
Hi, Paulson. My name is Mihiraa.
Mihiraa, I can see you're looking a bit worried, and I want you to know that we're here to help you. Let's take this step by step, and I'll make sure you understand everything we're doing. First, could you tell me what brought you in today?
Thank you. Nurse, I'm really worried because my surgical wound from last year's hernia repair hasn't healed properly. It's been bothering me a lot, and I don't know what's going on.
I'm so sorry to hear that you've been dealing with this for so long, Mihiraa. It must be really frustrating and concerning for you. Let's start by understanding what's been happening. Can you tell me more about the symptoms you've been experiencing?
Yes, there's been some pain, especially when I move around or lift things. The area around the wound feels swollen, and sometimes I notice a bit of discharge. It's been like this for a few weeks now.
Thank you for sharing that, Mihiraa. It's important for us to know these details so we can help you better. Now, to get a clearer picture, could you tell me a bit about your medical history?
I had my gallbladder removed about 5 years ago, but that healed fine. I don't have any major health conditions, but I did have a minor infection after the hernia surgery last year. It cleared up with antibiotics, though.
I appreciate you sharing that, Mihiraa. It helps us understand your situation better. Now, let me explain why an incisional hernia can happen. After any abdominal surgery, like your hernia repair last year, the incision site creates a natural weakness in the abdominal wall. This happens because the muscles and tissues in that area are cut and stitched back together during surgery. As they heal, the area may not regain its full strength, especially if there are additional factors that put pressure on the wound. One of the main reasons for an incisional hernia is the strain on the abdominal wall. For example, lifting heavy objects, sudden movements, or even excessive coughing can increase pressure inside the abdomen, pushing against the weakened area. This can cause the tissue or organs to bulge through the weak spot, leading to a hernia. Other contributing factors include infections at the surgical site, which can slow down healing and weaken the tissues further. Medical conditions like diabetes, obesity, or malnutrition can also affect how well your body heals after surgery. Smoking is another factor, as it reduces blood flow to the tissues, making it harder for them to repair properly. It's important to remember that an incisional hernia is not your fault. Let's work together to address this and get you back on track.
Oh, I see. So, it's not something too serious?
Not at all, Mihiraa. I want to reassure you that an incisional hernia, while understandably concerning, is a known and manageable complication. It's not something to panic about, and it's certainly not a reflection of anything you've done wrong. Many patients experience this after abdominal surgery, and the good news is that it's curable and not life-threatening. To support your healing, there are several steps we can take. First, proper wound care is essential. Keeping the area clean and dry, following any dressing instructions, and watching for signs of infection like redness or discharge will help the wound heal better. Avoiding strain on your abdominal muscles is also crucial. This means avoiding heavy lifting, sudden movements, or activities that increase pressure on the area. Maintaining a healthy lifestyle, such as eating a balanced diet rich in vitamins and protein, staying hydrated, and avoiding smoking, will also promote faster healing. If the hernia doesn't improve with these measures, there are other treatment options. Surgical repair is a common and effective solution, especially if the hernia is causing significant discomfort or complications. Remember, you're not alone in this. We're here to guide you every step of the way.
That's reassuring to hear. What should I do next?
I'm glad you asked, Mihiraa. The next step is to ensure you have regular follow-ups with the surgical team. They'll monitor your progress and adjust your treatment plan if needed. It's also important to follow their advice closely to support your healing. Would you be comfortable if I arranged an appointment with the surgeon for you?
Yes, please. I'd really appreciate that.
Absolutely, Mihiraa. I'll take care of that for you right away. Remember, we're here to support you every step of the way. If you have any more questions or concerns, don't hesitate to let me know.
Thank you so much, Paulson. I feel much better after talking to you.
You're very welcome, Mihiraa. It's my pleasure to help. Take care, and I'll be back shortly with the appointment details.